And this is a one-sided form, again, similar to the walking program information form. This form was created to quickly and efficiently communicate to the PTA what the goals of the chest physio program are for the resident. So again, you have the resident's name and date of birth at the top of the form. There's a paragraph about precautions, just to remind the PTA and whoever else may look at this form of what needs to be discontinued in terms of treatment if there's a problem, to always contact the physio if their condition has changed. Suggested techniques, so for example, mechanical percussor, if you want them to use I used to call it a mechanical vibrator, but I've changed that to the official word of percussor. How many minutes, and if you want them to do it in the back, in the front, the top, the bottom, whatever. Do you want them to do deep breathing exercises? How many repetitions? Sustained maximal inspiration. Do you want them to do it with or without percussions on sustained maximal inspiration, SMI? Pursed lip breathing for exhalation. Incentive spirometer, if there's a specific setting you want them to strive for. Percussions, clapping in brackets. Manual exploratory vibes or shaking, fine or coarse. Cough assist with pillow splinting, cough assist and crook lying, cough assist or stimulation with the forced expiratory technique or huffing or something else. You can also mention if you'd like them to do the treatment in supine, right or left side lying, or in sitting. You can check off which goal of treatment you're wanting to have with this treatment, whether it be increased air entry, mobilize the secretions, assist their cough, teaching or education or prevention of whatever. Suggested frequency of treatment. Sometimes here, if it's really a short-term chest thing, I might say 5 times a week for 2 weeks and PT to reassess or something like that. And then I'll go back to my name sheet and I'll write in 2 weeks, reassess so-and-so for chest. Who's going to be providing the treatment? Is it the PT or the PTA? Obviously it's for the PTA, which is why we have this form, but it's just to make it all complete for the college guidelines. And then your name, your signature, and the date. What I have determined with my assistants is I always circle deep breathing, sustained maximal inspiration without percussions, and pursed lip breathing all together. I usually circle all 3 and check it off and say, for example, times 10. My PTAs know that when I want them to do deep breathing, it means they take a big deep breath in, they do the sustained maximal inspiration for 3 to 5 seconds, and then they pursed lip exhale. That's my deep breathing exercise, is all 3 together. So I usually just circle all 3 and say times 10 reps. If you want them to do them separately, you can check them off separately. So that's up to you. So that's the chest physiotherapy program. And so now we'll take a look at the physiotherapy TENS parameter form, and that's what it looks like. It's got the body diagram on there. And again, this is a one-sided form, so another communication tool between yourself and the PTA to let them know where you'd like the TENS to be applied. Again, resident name and date of birth at the top of the page. You can draw the electrodes actually onto the body diagram, and you can show that if you want the cross wiring or the parallel wiring for the TENS, if you've got 4 electrodes. You can check off the region here, just in case. How many electrodes do you want to be used with the treatment? Is it 2 or 4 or other? What pulse width, pulse frequency, what's the time of treatment? I put the default as 15 because I think most of us would do it for 15 minutes with the option of other, of course. Frequency of treatment 3 times a week, again with the option of other. And the waveform continuous burst modulated. Most of our TENS machines have all 3 choices, so I thought it would be important to have that on there. And any comments that you have. So again, from the sensation testing form, if when you're doing your sensation testing you find there's an area of their skin that is not as reliable for sensation, then you can actually indicate that area on the body diagram form, which makes it very easy for the PTA to know where not to place the electrodes in case of a security or a safety issue. That's the physiotherapy TENS form. Okay, let's take a look at the physiotherapy quarterly reassessment form, and that's what it looks like. In nursing home and retirement homes, it is the same. It's also similar in the community homes. The only difference is at the top it says in-home physiotherapy quarterly reassessment instead of just quarterly reassessment or physiotherapy quarterly reassessment. So this is what it looks like. And basically it's got the same information as on the initial assessment form. However, to make it a little bit faster for the chart review, we have put medical status, medications, and cognition all together, and a lot of times these things stay the same, so you can just check off ISQ if it's the same and refer to chart. I should use the other side of the form because I've got holes punched in here. There's actually a little spot here for diagnosis, so you can write the diagnoses of the resident in this box. I forgot to mention this in the initial assessment form part, but I tend to write the short form for any type of medical conditions that may be precautions or contraindications for modalities later on. So I transfer that from my initial form to my quarterly forms all the time, every 3 months. So for example, if somebody has diabetes, I would write DM and circle it at the top of the form, the quarterly and the initial. If they've got metal somewhere, if they have cancer, a history of cancer, any sort of precaution or red flag thing that you notice in their history that may be a precaution, RA for example, rheumatoid arthritis, you can just write the acronym or the short form for it at the top of the form and circle it. I suggest anyways, it's just a quick reminder that they actually have something that's a red flag in case you're thinking, you know, a year from now you might think, oh, I think I'd like to do ultrasound on this person, and then when you look, oh, actually they have a history of cancer, maybe I should check into that a little bit, or whatever the case may be. For falls or any incidents that they may have had, you can, if you're aware of any recent falls, you can document it here, or you can just check off refer to chart. Subjective, objective with swelling, ambulation, transfers, and the rest of it is pretty much all the same as on the initial assessment form, a little bit squished with less area to write because this is a reassessment. Is there anything else different? I guess for the objective part, for the TINETI, the TUG, the Unipedal, and the 3-minute walk tests, there is a spot there where you can actually indicate is there an increase or decrease in their score since the last assessment, which may help you in your goal making, goal setting. Still have a room for your clinical impression or your analysis, room for resident goals, and the same boxes for agreed goals and treatment plan with the length of time in which you would like to achieve the goal, as well as the spots to fill in the blanks, and the treatment plan as well for 3 times a week, 5 times a week, or as specified below, and then your name and signature and date. So that's pretty much the same as the initial assessment form, and these are usually, it's the same, it's a double-sided form, but it's the same quarterly assessment on one side, and then 3 months later you can do fill in your quarterly assessment on the other side, so you've actually got 6 months, 2 quarterly assessments on one sheet of paper, which helps to save space in the binders and the charts, because we all know how much paper we can get into the binders eventually. So I do encourage you to use both sides of the page, and that's our quarterly reassessment form. Okay, so in retirement homes and community homes, we need to keep track of our reevaluations with residents. The college indicates that we have to see residents a minimum of every 3 months. In nursing homes, they're lucky. They have what's called RIMDS. Well, that's the unlucky part, but the lucky part of it is they've got their 3-month evaluations scheduled, so they never miss reassessing a resident every 3 months because it's planned for them because of the nursing home set up with RIMDS. So in retirement homes and community setting homes, there is no such thing as RIMDS, which is a good thing because that's a lot of extra paperwork. However, that does mean that you have to keep track of your own reevaluations to make sure that you stay on schedule with seeing the residents every 3 months. So we have a resident reevaluation sheet, and this is what it looks like. And basically, it's just to help you track your evaluations. So if you look, you've got a spot to write the resident names here. What I would suggest is enter the names of the residents on your program. This is an Excel document. If you would like to have the Excel document, you can contact support office. They can send it to you. You can type in the residents' names, last name, comma, first name. That way you can sort them alphabetically. Makes it really easy to follow and keep track of. When you say, for example, you assess Mrs. Apple on January 1st, you're working New Year's Day, yes, you would write a 1 under January, And anybody else that you assess on January 1st, if it's Mrs. Banana and Mrs. Peach or whatever, you would write 111 under January for the date that you reassess them. Then when it comes to April, all you have to do is look back to who did you assess in January, and you'll know who you have to do in April, and the approximate date. So it makes it very easy to follow. I like to color code things too. So if I've seen a resident in January, I highlight the box that I have the date written in. So when I'm going to set up my times for April, I'll actually look, and I'll preferentially look for the boxes in January because I'll highlight them yellow, and then I'll highlight their boxes in April so that I know in April I have these people to see. In February I might highlight the people who I've seen with a blue highlighter, so that in May I'm looking for everybody blue, and I'll just re-highlight the boxes in May blue for the people that I have to see. In March I might highlight them pink, and so then once I've seen them in March, I know I have to see them in June. I'll go highlight their box in June, so I can easily see who I have to reassess in which month. Sometimes it happens, let's say that I saw somebody January 1st, I've highlighted it, I'll go highlight April right away. In April, maybe I can't get to see them for whatever reason. They're sick, they're in hospital, who knows, sometimes these things happen. I'll write, I might write, if I went to assess them on April 1st and they weren't there, I'll write a small 1 with a dash, and I'll write S or H. I'll use the codes from the program log as to why I wasn't able to reassess the resident. And if I do get to see them, say on the 15th, I'll write 15, and then I'll check it off so that I know that I saw them on the 15th and that they refused or couldn't see me on the 1st. And I'll go re-highlight in July right away, knowing that they're due in July. It may happen that I know I'm going to be absent April 1st, so to not be late with my reassessment, I'll go see Mrs. Apple in March instead. Maybe I'll see her on March 24th. So I'll write 24. Now my new reassessment would be due in June instead, because I saw her in March. So I saw her after 2 months here, so now I have to see her after 3 months, which would make it June. It's just a way to keep track. I find it works really well, and you can do the same sheet on both sides so that you have lots of room for resident names. And if you have any comments, this is just an open spot. If there's something that you need to write, like maybe the resident moves out of that retirement home or that community home, or maybe they pass away, you can write here deceased or passed away or moved and the date, so that you know that you don't have to see them anymore, for example. I usually write the year at the top of the sheet, so 2011, say, I would write at the top of the sheet, and I would have all my resident names. And as the year goes on, more people are going to come onto the program. I'll just add their names at the bottom, so that at the bottom they won't be in alphabetical order. When I prepare my sheet for the following year, I would change it to 2011. I'd just write it with pen, 2012, say, and then I would enter the names that I had handwritten on my computer sheet, and I would resort it alphabetically by their last name. So at the beginning of 2012, I have a fresh list of everybody that's in the building or in that home. And I think that's it for the resident reevaluation sheet. With Colago now, if a resident is overdue for their 3-month reassessment, Colago, every time there's a service billed and that resident has not had their 3-month reevaluation, Colago will send a warning email out to the PT as well as to support office saying, Mrs. Smith requires reassessment, and when you open the email, it'll tell you the date that she had her last assessment with the PT. So it's just to help keep everybody on the ball so that we all meet our college regulations by about seeing people every 3 months. So use the sheet to plan your months and to plan who you're supposed to see when, and if ever something happens and you don't see them, well, every time that resident is billed for a treatment and you haven't reassessed them, you'll be getting an email to remind you to do that reassessment. So in community and retirement homes, the doctors may not be coming into the home on a regular basis. In nursing homes, we don't need to do a special report to send to nurses or to doctors, because we can actually document in their charts. It's not so easy in retirement homes and community homes, so there is, you don't have all the RIMDS stuff to do. What we do ask though, and this is a very good practice to get into, is after you've done your initial assessment with a resident, You take out the physiotherapy initial assessment report, and this is what it looks like.